How does integrative medicine work with our current health crisis?
Yeah, so this is a very long discussion, but I'll keep it brief.
Yeah.
You know, we have now successfully managed the smoking and tobacco industry.
Right.
And because of that, we are seeing now in our mortality and our other outcomes huge benefits. And already in 5 or 10 years, we're seeing that improvement. We also have a big food industry. And the food industry really is the next tobacco industry. You know,
Oh, that's true.
Yeah.
I agree with
the
that.
food that we're eating is causing the majority of the chronic illnesses that that we have. And I'll just speak about myself. Most of you in the audience can see, you know, I'm not obese. 5 or 6 years ago, 7 years ago, I was diagnosed with fatty liver disease. And I was like a toothpick. So how did that happen? How did I have fatty liver disease without even being obese? And it was because of my diet. And that really was very eye-opening for me, because fatty liver disease can kill you. It can cause cirrhosis if you don't manage it.
How do you know you have that?
Well, I just had routine blood work, and my liver enzymes were a little bit off, you know, and after seeing, you know, some more imaging and doing the right evaluation, you know, I saw it with my own eyes, but as a physician and as someone that was fine, I mean, I wasn't debilitated in any way or feeling sick. I just said, forget it, you know, no big deal. Meanwhile, I'm writing prescriptions and taking care of patients that have fatty liver disease, but as a physician, I didn't want to believe that I had it myself because I looked fine.
Yeah.
And it wasn't until the integrative training that, you know, it really kind of clicked for me that, you know, what was I doing? You know, I mean, that was very irresponsible of me to not look after myself with this disease. And that's when I started realizing that you can't drink 4 sodas a day, you know, the way I was before. You can't eat the fast food the way I was. You can't do all those things that I thought were fine because I looked fine, I felt fine. You know, but since I've stopped, or I've not stopped, but I've really cut down a lot, I feel completely like a different person, even though I already felt well in the first place. And really, the healthcare crisis that we have now, and the reason why we're number 22 out of 24 on all kinds of lists, mortality in so many places,
Is that right?
is because of the food. So that's where an integrative approach can help our total healthcare crisis across the nation, and really focusing on food. You know, we